All right, today we're diving into a medication called Domcet. Now this one is pretty interesting because it's specifically designed to tackle that awful combination of symptoms you've probably had before. Let's get right into it.
You know the feeling, right? Your head is absolutely pounding, your body is aching with a fever, and then, to top it all off, your stomach just decides to join the party. It's that terrible feeling where you know taking something for the pain isn't going to solve the nausea and you're just stuck feeling miserable.
Well, that's exactly where a medication like Domcet comes into the picture. It was literally engineered to be a two-in-one fix for that exact scenario.
So Domcet is what's known as a prescription-only combination drug. And all that means is that they've packed two different active ingredients into a single tablet, and each of those ingredients has a very specific job to do.
Here they are, the two players on the team. First up, you've got 325 milligrams of paracetamol. You probably know this one. It's that classic, reliable pain and fever fighter. And batting second is 10 milligrams of domperidone, which is there specifically to shut down nausea and vomiting. It's a really targeted, two-pronged attack in one convenient tablet.
Okay, so we know what's in it, but how do these two ingredients actually get the job done inside your body? Let's take a look at the science behind it.
Think of paracetamol's job as being the one to quiet down your body's internal alarm system. See, when you're sick or you get injured, your body produces these chemicals called prostaglandins. They're the ones that send pain and fever signals screaming to your brain. Paracetamol works by getting in there and reducing the production of these chemicals, essentially just turning the volume way down on those alarm bells. And the result? You feel less pain and your temperature starts to come back to normal.
Now, domperidone is a bit of a multitasker. It tackles that stomach problem from two different directions. First, it goes right to the source, the vomiting center in your brain, and it blocks the signals that are telling your body it's time to be sick. At the same time, it helps get your digestive system moving again, which helps relieve that awful bloating and discomfort by encouraging your stomach to empty out a little faster. So it's telling the brain to calm down while also telling the stomach, all right, let's get back to work.
So, when you put it all together, you get the whole package of relief. The paracetamol is taking care of the pain and the fever, while the domperidone is handling the nausea and that uncomfortable stomach feeling. This combined effect is exactly why it's prescribed for those really tough situations where you're dealing with all of it at once.
But, with any medication this effective, understanding how to use it safely is every bit as important as knowing how it works. So let's go over the essential guidelines.
You can probably see the pattern here, right? A doctor might prescribe Domcet for any condition where that double whammy of pain or fever plus nausea is present. So we're talking about things like a bad flu, severe migraines, stomach inflammation, or even to help with recovery after surgery when these symptoms often show up together.
Now, the instructions are super specific and for a very good reason. Taking it before meals, that actually helps the domperidone part get absorbed and work more effectively. For adults, the typical dose is 1 tablet with a full glass of water about every 8 hours or so.
And this number right here, this is a critical safety limit. 3 tablets in a 24-hour period. That is the absolute maximum for an adult. Sticking to this is so important to avoid the risk of an overdose, especially from the paracetamol, which can be really dangerous in high doses.
It's really important to understand the difference between common side effects and the more serious risks. You might experience some milder stuff like a dry mouth or feeling a bit drowsy. But the serious risks, well, they're on another level. An overdose of paracetamol can cause severe, and I mean severe, liver damage. And in very rare cases, domperidone can affect the heart's rhythm, which is a serious issue. This is exactly why following that dosage is non-negotiable.
So, because of those risks, there are definitely some people who should stay away from this medication entirely. Anyone with significant liver problems or known heart rhythm issues should not be taking this. Same goes for anyone who has a blockage or bleeding in their digestive tract, or, of course, anyone who knows they're allergic to either of the ingredients.
Mixing medications can be a recipe for disaster, and Domcet is no exception. Alcohol is an absolute no-go. It dramatically increases the risk of liver damage when combined with paracetamol. And it's not just alcohol. Certain other common medications, including some types of antibiotics and antifungals, can interact really badly and increase the risk of those heart-related side effects. This is why you have to tell your doctor about every single thing you're taking, supplements included.
Whew, okay, that was a lot of ground to cover. So let's boil all of this down into the most important takeaways you need to remember. If you remember just one thing, let it be this. Domcet is designed for short-term relief. It is not a long-term solution. Responsible use is everything.
You have to stick to the prescribed dose and never ever just decide to take it on your own without talking to a doctor first.
Let's just run through a final safety checklist. Think of this as your quick reference guide. Always take it before meals. Strictly avoid alcohol. Do not go over 3 tablets in 24 hours. If you feel any serious dizziness, notice any yellowing of your skin, or just feel unusually tired, call your doctor right away. And finally, store it properly, away from light, heat, and moisture.
And that brings us to a final thought. Really understanding how a combination drug like Domcet works, how the ingredients are designed to be a team, it makes you wonder, doesn't it? How much do we really know about what's going on inside our other medications? The more you understand, the more empowered you are to take charge of your own health. Thanks for tuning in.